So today we're going to talk about weight loss. You all don't have any patients that have any weight issues, do you? No? Right? No. How many people in here have patients with weight issues? Everybody, right? It's the #1 problem that we see. So we've changed the focus of the talk a little bit. I know in your syllabus it says that we're talking about a novel approach to treating self-sabotage and weight loss, and we are going to talk about that a little bit, but we expanded the topic to include a functional medicine approach to weight loss, to kind of give you a comprehensive overview of the program I use and lots of functional medicine physicians use to approach the patient with weight issues. So I'm going to go through that. Now, I gave you a lot of slides. More slides than we can go over in an hour, but I wanted you to have all of the information as a reference so that you can go through it and use it as kind of a textbook when you're seeing your patients as to what do I do with this, what do I do with that. So I'm going to focus more on what is the program. I use a 4-phase program and kind of skip over a little bit in the beginning because you all know what the problem is, you all know how much it's costing us, you all know what the issue is. So I'm going to focus more on the treatment, and then at the last 15 minutes I'm going to make sure that I skip to the part about the specifics of the program, including the transformative coaching that I use to treat self-sabotage. How does that sound? Ready? Okay. All right, so obesity and weight loss, getting it right. The name of my book is Cracking the Bikini Code, 6 Secrets to Weight Loss Success, and it will be out by the end of the year. It is almost complete, and I hope to make available to all of you a copy. It's going to talk about exactly what I'm going to talk about with you here today, more in lay terms for people. I'm going to talk a little bit about myself because I speak to you today not only as a board-certified physician, but also as a person who has had weight issues. And I think it's very important that when you practice age medicine, AMM, age management medicine, or functional medicine, that you walk the walk, that you demonstrate for your patients how to do this, and that you don't ask them to do anything that you're not willing to do, that you demonstrate this. If you're hypocritical and you're asking them to avoid gluten or exercise and you're not doing it, your efficacy is going to be 0. So I was an OBGYN for 14 years in Savannah, Georgia, and I lived the OBGYN life, which is no sleep, constant stress. Every time a baby comes, it's an impending disaster, surgery, and just all the stress that goes along with that. And I got up to 243 pounds. And a size 22. But more than that, well, the weight was one thing, but I was depressed. I had chronic fatigue syndrome. At the time, I didn't know it because I had never heard of that. I didn't really know what it was. And I really had not much of a life at all. I tried all the things that I knew how to get myself healthy. I would run tests, thyroid. I would go to my primary care physician. She would run tests, and she'd say, well, they all came back normal. And she'd send me to a specialist, and they would run tests, and he would say, well, all your tests are normal, so there's nothing wrong with you. How many of you have patients who have been to doctor after doctor after doctor and told there's nothing wrong with you, right? And then they come to you, and what do you find? They have all kinds of things wrong. So this was me in mainstream medicine. And then a patient gave me a book one day and said, you need to read this book, it's going to help you. And it was a Suzanne Somers book. And I took it home, and I said to my husband, what is Chrissy on Three's Company going to teach me that I don't know? I'm a board-certified physician. So I put it on my nightstand, and I said, well, I wasn't really going to spend the time reading that. But then one day, since I had chronic fatigue, because I didn't really know what it was anyway, but I was going to be in bed all day Saturday, and my kids and my husband came in and said, we're going to the movies. They didn't bother asking me anymore because they knew I was never going to go anywhere. So I knew I was going to be in bed all day. And I said, let me pick up this book and just look at it so I can give it back to her and say, thank you very much, and just, I'm done with it. So I picked it up and started reading it, and it actually was pretty good, and it was pretty interesting, and it made a lot of sense. And I don't know how many of you have read Suzanne Somers' books, but I think how she approaches this topic is brilliant because she doesn't give her opinion. She interviews doctors and scientists in this field, so it's their opinions. She's just the vehicle that brings it to the public. And before long, I was reading it like it was the Da Vinci Code. Boom, 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 boom. And I read the whole thing in one day. And all of a sudden, the door cracked open, and there was a little light and a little fresh air, and there was hope. Wow, this whole branch of medicine I never heard of. I might be able to get better. There might be something really wrong with me. I might not be crazy. And I decided at that moment that I was going to do whatever it took to learn about this type of medicine and get myself better. And that's what I did. So long story short, I lost 100 pounds, found out I had chronic fatigue, I had flatline cortisol, got myself better, had thyroid problems, hormone balance, you name it. And then my patients want to know, well, what are you doing? So I started doing it with them, and then they started having results. And then before long, this is all I wanted to do, and I actually closed my GYN practice 2 years ago, and I've done this full-time for 2 years. So anyway, walk the walk, do what you ask your patients to do, and they will follow you. So this is me now, 140 pounds. Thank you. So now it's my passion to help patients change their lives, to talk to professionals about what I do and how I do what I do, because by touching each one of you, I can touch all of your patients, and that means that I can help way more people. So I'm so glad to be here, and I was so excited to hear that 40% of you are newbies. You are in for the ride of your life with functional medicine. It will just reignite your passion for medicine and why you went into it in the first place. So learn as much as you can and follow the path. All right, like I said, I'm going to breeze through the problem slides because you guys know the problem, and that's not really what you're here for. You're here for clinical solutions. Everybody want clinical solutions? Yes. Okay. So I'm going to breeze through these. Overweight and obesity, you know how to define them. They'll be in the slides for you. And 70% of the population has a problem with this. You guys have seen this slide over and over again about the increasing obesity in the United States. Childhood obesity, type 1 diabetes in grade school children, and also fatty liver. It's increasing at alarming rates. This generation of children is not going to live as long as their parents. It is a serious problem. Economic costs are huge, huge. Fat, skinny people, I see these people all the time. I call them fat, skinny people. They look skinny, they work out all the time, but they have these pockets of fat, and they're sometimes just as sick as the people who grossly look